If you're a cancer patient or survivor, this is a very important video for you to watch because we're going over essential vitamins after cancer. And if you've been through cancer treatment, there's a very good chance that you're low in the 3 essential nutrients I'll be talking about because most people are. But here's the thing. Fixing these vitamin deficiencies will not only help you to stay healthy or feel better, they'll also lower the chances that your cancer will come back. Now, these are just common everyday vitamins that you've probably heard of before, even from myself, but today I'll be giving you some real-life examples of how powerful these simple vitamins can be after cancer. I have 4 amazing stories of how different cancer patients of mine saw huge improvements in their energy levels, pain levels, and quality of life simply by taking a few vitamins. And I'm really excited to share these stories with you because I know you'll be able to relate to some of them, so let's get into it. Starting with Linda, lovely lady in her 50s, went through chemotherapy and radiation treatment for breast cancer. And even though she was tough as nails and a ball of energy, her treatments left her with horrible fatigue that she just couldn't shake for months. The kind that just makes you feel totally wiped out. I mean, this poor woman was exhausted just sitting up in bed. And obviously this was super frustrating because this was not the comeback she expected after treatment, right? So she asked her family doctor to run some blood tests and found that her vitamin D levels were shockingly low, like practically non-existent. Turns out chemo doesn't just attack cancer cells, it also messes with your body's ability to absorb really important nutrients, vitamin D being one of the big ones. So her doctor got her started on a high-dose vitamin D3 supplement, and amazingly, after only 3 weeks, her energy levels were back to normal. Obviously, it wasn't an overnight fix, but she slowly went from having to nap after breakfast to going for walks again. Typically, vitamin deficiencies do take at least a few weeks to fix, especially if you're very deficient in them like Linda. So when you start taking supplements, you have to be patient and take them for at least a few weeks. I know a lot of you could probably relate to Linda's story because fatigue is one of the most common side effects from cancer treatment, and so is a vitamin D deficiency. But there's way more to vitamin D than just energy levels. Probably heard that it's important for your bone health because it helps your body absorb calcium. But why is it so important after cancer treatments? Well, there are at least 3 ways that vitamin D can help you fight cancer. It regulates cell growth, lowers systemic inflammation, and it strengthens your immune system, which is key for your body to be able to identify and destroy precancerous cells, stopping them in their tracks. Now listen to this. Studies have even shown that having normal vitamin D levels after cancer can lower your risk that your cancer will come back, especially breast and colon cancers. Now, I don't want to oversell it. Obviously, vitamin D isn't a miracle cure or a replacement for cancer treatment, but if it can give your body just a little extra defense, why not make sure your vitamin D levels are where they need to be? I had another patient, Frank, a colon cancer patient, who developed really severe bone and muscle pain from chemo. The poor guy couldn't even get out of bed some days without feeling like his joints were on fire. And he was a super active guy before cancer, always out hiking, but then after chemo, he could barely walk around the block. I remember thinking, we need to test this guy's vitamin levels ASAP. So we did, and lo and behold, both his vitamin D and magnesium levels were rock bottom. But after a few months of taking vitamin D3 and magnesium supplements, the turnaround was amazing, and he was back out doing hiking trails. Now you may be wondering, how do I get more vitamin D? Great question. Sunshine is a great source, but if you're trying to avoid the sun, you can eat more foods like eggs, mushrooms, or fatty fish like salmon or mackerel. But here's the thing, it's not easy to get enough vitamin D from eating these foods, especially after cancer treatment because your body may not be absorbing nutrients as efficiently as before. So getting your vitamin levels checked is always a smart move. A simple blood test will tell you if you need a little extra help from supplements. Next, I want to tell you about Judy, a lung cancer survivor. After finishing treatment, she was really stressed and anxious and just could not get a good night's sleep to save her life, so she was always exhausted as well. If you've ever gone through a period of not being able to sleep, I know you can relate. I know I sure can. Having insomnia can really affect your mood and make your anxiety worse, especially after a big life event like cancer. But poor Judy just thought this was her new normal. She didn't like taking medications, so she didn't want to take any for her anxiety or to help her sleep. So I suggested she go see a naturopath. And it was her naturopath that immediately checked her vitamin levels, and lo and behold, her magnesium levels were super low. You see, for some people, magnesium can act like a little chill pill. And that's because magnesium helps to calm your nervous system when your body is stressed. But magnesium also helps to regulate your natural melatonin levels, which is the hormone that controls both your sleep depth and duration. So this is important because if you're deficient in magnesium, you may not even notice it, but you may not be entering a deep sleep at night, which can make you feel tired during the day. What most people don't know is that magnesium plays a role in over 300 different processes in the body. It supports your heart, muscles, nerves, and bone health, which is exactly why it's crucial after cancer, especially chemotherapy, which puts your entire body through a lot of stress. So if your doctor gave you the okay to start taking vitamins again, the recommended daily allowance for magnesium is 400 to 420 milligrams for men and 310 to 320 milligrams for women. But if your oncologist is telling you not to take any vitamins or supplements right now, you can get magnesium from eating things like pumpkin seeds, almonds or cashews, beans, avocado, and dark chocolate. So once Judy started taking a magnesium supplement and adding more magnesium-rich foods to her diet, she noticed a difference in her sleep almost immediately. Her naturopath also put her on vitamin B6 supplements, which are known to help with relaxation. And it was only a couple of weeks of taking B6 before she felt more relaxed and less anxious. Now, if you've ever experienced chemo brain or brain fog in general, I know you'll be able to relate to this next story. I mean, we've all walked into a room and forgotten why we were there. And if you find yourself often searching for a word mid-sentence, and then you realize your memory is just not what it used to be, it happens to the best of us. So Karen, another breast cancer patient of mine, was still struggling with low energy and brain fog even months after finishing treatment. She just couldn't shake it. She had a healthy, balanced diet, she was trying to exercise, and she just couldn't figure out why she was so tired. Then finally she asked her doctor to test her vitamin levels, and her chemo and radiation had made her deficient in, oh my god, magnesium, iron, vitamin B, vitamin D, you name it, she was deficient in it. So no wonder she was feeling so tired, and the brain fog was likely from a vitamin B deficiency. B vitamins do a lot for your body as well. I go over the importance of them after cancer in another video, but just to name a few things, they strengthen your immune system, they help your body make more blood cells, and because they support your brain health, they can help with brain fog and even improve your mood. So along with all the other vitamins Karen needed to start taking, she took a B complex supplement because several of the different B vitamins can help you think more clearly and help with your memory, problem solving, concentrating, all those things. Specifically, I would recommend taking a combination of vitamins B1, B2, B6, and B12. So because Karen was deficient in so many different vitamins, it took about 4 to 6 weeks until she regained her mental clarity, normal energy levels, and just felt better overall. So if you've been through cancer treatment and you're still struggling with lingering side effects, you may very well be deficient in these important nutrients like vitamin D, magnesium, or B vitamins, just to name a few. And taking these supplements can not only make you feel better, but they're also really important for keeping your cancer from coming back. So if you're feeling extra tired, sore, or just off, ask your doctor to check your vitamin levels. A simple supplement can make a world of difference. I know that was a lot of information in less than 10 minutes, but I hope you were able to benefit from it. I really appreciate everyone who has subscribed and leaves me lovely comments. I am forever grateful, and I'm leaving you with another video to watch next on the top 10 foods to be eating after cancer.